I've seen the comparison in terms of clots associated with birth control pills, comparing that to what we're dealing with respect to these unusual clots with low platelets. And so the first thing that I wanted to say about that is that, it is difficult to kind of wrap your head around these large abstract numbers and relative risks. So that's the first part. We understand that. The second part of that is that it's really important to compare apples and apples and oranges. So with respect to the numbers that we've seen with blood clots and, the birth control pill, for example, those are not the same types of clots that we're seeing with the vaccines. So, and maybe just to take a moment on that, it's also that, so if you're a woman between the ages of 15 and 45, your risk of a blood clot is around 1 in 3,300. If you take a birth control pill, that goes to 1 in about 1,600. Some of that is just background rates, just the natural sort of incidence. If you are pregnant, it goes to 1 in 300. If you are right after your pregnancy, it goes to 1 in 100. If you are in hospital with COVID-19, your risk of having a serious clot is 1 in 5. So I think we just, if we're talking about clots in general, and we're talking about the sort of the risks and benefits in that area, obviously the risk of clots with regular clots with COVID is much, much, much higher than with other things that we talk about in terms of benefits and risk. And it's much, much, much higher than having this very, very severe clot. So then let's look at the types of clots that we're dealing with. These are extremely, extremely rare. And again, we're using 1 in 250,000 as an estimate. We look at what, another thing that it's like. So one of the hypotheses about what's causing this is really an activation of the immune system that then leads to platelets, these clotting things being activated, causing clots, and then because those platelets are consumed in the process, the overall count goes down. It's likened to what we see with heparin. Heparin is a medication that seems to trigger the same type of reaction. We still have heparin on the market, right? We still use it. We still use it for prevention. We use it in syringes, for example, to prevent clots, even though there might be alternatives to it. So it is, we have to look at, I think it's helpful sometimes putting in context with other types of clots, but really the thing that we're looking at is this very, very rare chance of having this severe clot that you can diagnose and treat, and potentially getting sick with COVID, getting seriously ill, potentially dying, and all of the other effects that could occur with COVID. And for all of the age groups, especially when we're in the situation where the risk of COVID is moderate or high, as it is in many parts of the country, the benefits of the AstraZeneca vaccine far outweigh the risks in all age groups.
Thank you. Follow up?
Yeah, no, thank you for that explanation. That really helps, at least in my mind, to clarify things. I wanted to get some clarification on something that Dr. Berthiaume said about NACI possibly considering changing the age eligibility for AstraZeneca. Did I hear correctly that it might change to 35 and over? Either Dr. Berthiaume or Dr. Sharma.
Yeah, so just to say, I think
Supriya, if I may, maybe I misspoke. Just want to clarify for the benefit of all of the audience. Maybe I did a lapsus in French. I never meant to say 35. If I said 35, I meant to say 55. So sorry if there was a mistake. I'll have to look at the recording to see what I said. But in my head, I said 55. So just want to be clear for everyone.
All good.
Thank you.
So I think, but just to clarify, so NACI is looking at it again. We presented our data to them, so they have the same summary data that we looked at, and then they will be providing their recommendation. So that may include a change in age, or they're relooking at the age, but also their overall recommendations about the optimal use of the AstraZeneca vaccine in the context of the current epidemiology, as well as the availability of alternatives. But but right now, their recommendation is still the same: AstraZeneca for use in people ages 55 years and older, That does not mean that it cannot be used in younger people. It is a recommendation. It certainly is up to the provinces and territories. There have been other times where NACI has made recommendations and provinces and territories have decided to use either vaccines in different ways. So again, I think it's the public health side of things, making recommendations to the provinces and territories. And the other thing that I just wanted to sort of stress is that we're seeing this in all countries. So almost all countries have a Health Canada equivalent as the regulator and a NACI equivalent as the body that provides recommendations on the optimal use of the vaccinations. On the regulatory side, so the comparable organizations from Health Canada, all of the regulators have basically been in line. They've noted that this might be an adverse event. They've noted that it's very rare. They've noted that they're continued to follow up on it, but they haven't restricted the use to a certain age range or sex. But we do see in the public health side of things in the recommendations that different countries have taken different approaches on the rollout and the use of the vaccine based on their current local circumstances.